Hi, Dr. Pensak. Welcome to the show. I'm very excited to have you on today.
Hi, Laura. Thanks for having me. I'm excited to be here.
I'm really looking forward to you sharing about the book that you just have recently published called Rattled: How to Calm New Mom Anxiety with the Power of the Postpartum Brain. And before we really delve into that content, I would love for you to just share a little bit about who you are and why you chose to write this book.
Sure. So, I'm a clinical psychologist and I specialize in perinatal mental health. And around the time when I wrote the book, I was actually building a program of research around caregiver stress management. And I was pretty set in my academic research trajectory. But then personally, I became a mother twice. And the second time, I experienced severe postpartum OCD. And I really hit my rock bottom, but then I was able to get to thriving pretty quickly, and as an academic, went back to the research to understand what's going on in a woman's brain when she becomes a mother, and how on earth did I get from rock bottom to thriving so quickly, and I really uncovered a story that's not being told, but I think, everyone really needs to hear, and I felt like I had this story to tell, and I was used to writing for academic journals and nobody reading it, and I really wanted to get the highest quality science out to the layperson and write it in an engaging way, and so that was really my mission with Rattled.
Got it.
Yeah.
So it is so cool when we become moms how it really that the creation that goes into creating a baby allows us to create other things like books and practices and businesses and all types of things are birthed from the energy in our second chakra getting fully utilized, right? And really being in that feminine nature. I mean, there is nothing more feminine than being pregnant and giving birth, right? So I find that that is such a great way to um, kind of get clarity about some purpose, like why are we here, and what do we have to offer? And with your background as a psychologist and already having clinical experience in working with postpartum moms, but then going through the process yourself, I think is a very enlightening to have the personal and professional experience.
Exactly, and I think mothers don't know, and society doesn't know what kind of power happens when a woman becomes a mother and the brain changes that happen that actually, like just said, translate to the real world and other, skills, and so while your brain is becoming more efficient and better at problem solving and going through building these neural networks and being more creative in problem solving for your baby, you're right. It's actually a great time where the brain is primed for new learning, and it's a great time to take on a new, challenge or to be creative, and I feel like the transition to motherhood just sort of up is this big transformation in a very short period of time, and I think we are focused on the baby and how to support the baby, how to keep the baby alive, but really it's, how we need to help the mother and support the mother during this transition so that she can make the most of this period, take advantage of these brain strengths and get to the other side where she really feels thriving and her best and more creative, and I certainly felt that as well was when I was writing Rattled.
Right. Exactly. So and 100% this podcast is really about that mama self-care. And especially for that fourth trimester after a woman gives birth, it can be so overwhelming. Um, and we need a village to support us and help us with recovering from pregnancy and birth, you know, um, caring for a newborn, and then making sure the rest of our needs are getting met, right? Are we getting well nourishing foods, or someone else is cleaning our home and doing our laundry and all the things that can be delegated that do not have to be done by that new mom, because we do see in other cultures that is what has always been happening for thousands of years is women were never expected to like snap back, go back to work, produce any of those things. They were supposed to stay in bed and breastfeed their baby. Really, that is all they had to do. And And we've kind of moved away from that because we don't necessarily have all those family members living near us anymore. And so there's that cultural change that's occurred and that can be really at the deficit for moms, right? And I think you also shared something that was very interesting is first time motherhood is pretty intense because it's your first time, but it can also be intense for a second, third, fourth birth, right? Where you're like, okay, I already know what to do, but it's a different baby, it's a different birth, and you can have a different experience in that fourth trimester where like you didn't necessarily have the mental health issues after the first one, right? And the second one, you saw a shift. Do you have any ideas of, like, what was different between that first and second birth for you personally?
Well, there was a lot that was different. I mean, I did suffer from mild postpartum anxiety that it was easily treated with like some therapy sessions and just, coping strategies. The second time was different because my son was in the NICU for 5 weeks, and we know that's a risk factor for experiencing postpartum. It was also
Yes.
he was born in January of 2020, and 5 weeks after right after he was discharged from the hospital, we were on lockdown from COVID, and my husband was working on the front lines, and so I was getting information from him and his doctor's chat overseas about how COVID was, about to come to the US, and it had started in Seattle, and it was sooner than the news was really focusing on it. So I felt like we had this inside information, and it was really terrifying for me.
Yeah, a lot of fear.
A lot of fear. I had also, for my second child, decided that I wasn't gonna breastfeed, but because he was in the NICU, I did end up breastfeeding for those weeks, and then as soon as he got out, I was like, "Okay, well, this wasn't in my plan," and I was committed to not breastfeeding because I wanted to preserve my sleep, and so when I was weaning, I also went through the hormonal shift around the same time, and it was like the perfect storm.
Yeah,
It
so
really
many things going on.
so many things going on.
And to your point, these external factors that we don't have control over, right? Like whether a child's in NICU or things going on globally, we can't control those things, right? All we can do is just focus on our own thoughts and our own beliefs and our own, support system. So, but when those things are happening, we can recognize that would create heightened fear, stress, and these danger signals, right? That your nervous system essentially was not feeling safe, and if mom's not feeling safe, baby's not feeling safe, right? Because they're co-regulating through us. So it is really interesting to have those awareness for women if things are happening. I know I don't recommend watching the news for pregnant and new moms because I think it's way stressful and unnecessary to have all that bombardment. There's not typically a lot of good things going on in the news. So I don't think that helps with her mental emotional state, right? And then you also cover an interesting thing about weaning, whenever that happens for a new mom, and how weaning is contributing to potentially mental health disorders.
Yes. So, I mean, you said a lot. I just want to unpack a couple of things. I do want to reassure moms that even if you are terrified or going through postpartum, it doesn't necessarily mean that the baby is going to absorb that or take that into account so early on. And you can still feel terrified and your baby feel safe. I think it's also important to get help as soon as possible and get treatment. But I think that um, mothers should understand that because they already feel bad enough that they have postpartum or are really, suffering. And then, I have a lot of recommendations for how to manage the stress and prepare yourselves for postpartum earlier on, really proactively. So I say once you pee on that stick, set yourself up with a mental health provider and prescriber that specializes in perinatal mental health. And so that way, You can establish a baseline with them. They understand you, they know your history, they can explain to you your unique risk factors for potentially developing postpartum, but they can also prevent it. And then they're following up with you automatically after you give birth at certain time points where you're most vulnerable, that being also when you're breastfeeding, because weaning can come, 8 months later, a year later, 2 years later, and so it's important to line those appointments up. But also after you give birth, you're in the throes of it. It's really hard to problem solve if you're experiencing postpartum depression or anxiety. So you want that safety net already there so that you can just show up to your appointment virtually or otherwise, and they can let the doctors take care of you.
Mhm. 100%. And what I do a lot of times when I'm working with women for preconception is we can talk about if they already have a history of anxiety and depression, how to really support them before getting pregnant, because then they're really entering that pregnancy and birth from a different mental health state,
Yes.
with functional medicine. So, and then also like not just the nutritional component, the nutrients, making sure their nutrient levels are well managed and optimal. But then, like you mentioned a little bit about coping strategies, which I'd love for you to delve into more, but recognizing once again, if your nervous system, as a chiropractor, I'm all about nervous system balance and parasympathetic, sympathetic. And we can have an awareness if our nervous system is not feeling safe, right? And this is could be years before we become pregnant and give birth. So that's the optimal time to start doing the work. I say to help get yourself in a state, where you're feeling safe. Essentially, you have that vagal tone, and if things start to creep up, how to react to them. Essentially, so what are some of the coping strategies that you use with your postpartum women?
So I predominantly practice from a cognitive behavioral theoretic orientation, and it's all science based strategies for promoting stress management and thinking. And so I offer a lot of strategies in the book and also how to think about coping. And I focus on things that you can control and how to manage the things that are outside of your control in productive ways. And so I have a lot of different methods depending on what the issue is. So it just depends. But I have strategies for mom guilt, mom shame, baby bonding, mom rage, relationship changes, back to work transitions, understanding identity changes with matrescence, the developmental phase of becoming a mother. Um, and also, proactive postpartum mental health care planning.
Yeah. So, can you talk a little bit about because when I read your book, I saw that you had separated mom guilt versus mom shame, and I thought that was really a relevant point. So, I'd love for you to just kind of clarify the difference between those two things?
Sure. So mom guilt is I did something bad, and mom shame is more internal core, like I am bad. So I'm a bad mother. I'm not cut out for this. Mom guilt is like I feel guilty leaving my baby right now to go exercise or to go, do anything for myself. And so I have the double down method for mom guilt, and I look at it from a diagnostic perspective. So mom guilt, you have to think about how often you're experiencing mom guilt, how bad does it get, and does it actually interfere with your day or ability to function, right? So, like, if you have so much mom guilt you can't, like, take a break, then you're at risk for, burnout, postpartum, all of these things, and so that's where it's, like, really interfering with functioning, and so I say that the thing that you feel guilty about is probably the thing you need the most. So you need to take more breaks. You need to maybe delegate some tasks. You need to get help or instrumental support, right? I give the example of a mom going out to dinner with like her girlfriends, right? And staring at the baby monitor the whole time because she feels
Uh,
guilty being out of the house or away from her baby. And if she's looking at the monitor the whole time, she's not actually getting the benefits of socializing or taking a break. She's not refilling her cup in any way. and it's not serving her. So I tell mothers to actually double down and make it bigger, increase the pleasure that you're experiencing with whatever it is that you're doing. So if you're at, dinner with your girlfriends, put the phone away,
Yes.
engage in conversation that's going to feel fun, or enjoyable or meaningful. I would order your favorite food or drink. I would really try to enhance all your senses in the best way you know how and bring yourself the most pleasure out of it because that's truly what's going to benefit you and refill your cup and, make you feel better so that when you get back to your baby, you're more restored.
Yes.
Also, it has incredible brain benefits to sort of do experience these positive emotions, and it helps you problem solve more effectively and be more creative, right? And so, and there's a whole body of research on that that I include in the book as well.
Yeah. It is true. Like we want like when you make that big commitment to go out of the house and leave your baby for the first time, you're like, "Oh my god, what am I doing?" And then once you're there, definitely put your phone away and really cherish this opportunity to connect with your girlfriends, because it is so, cup filling. It's so important for us women to have those connections and bonds and do it in a social setting that doesn't involve childcare, right? And that break is so nourishing for us as well. So those are important. Also, scheduling date nights, I think, is so important for the relationship, the intimate relationship. And I do have families coming to my practice, and it's been months since the baby was born, and they haven't gone on a date night. And that's not optimal, right? Like the husband and the wife, if they're married, both really need that time together to just connect. And they don't even have to talk about the baby. They can talk about whatever they want and just connect as partners.
Absolutely. Those are great recommendations.
So I would say sometimes the challenge is childcare in those cases, right? So there's sometimes it's like there's a fear of who's going to watch my baby. Maybe, there isn't family members locally that are available. So do you have any recommendations about finding trusted childcare providers so that you can take these breaks and dates?
Yeah, I mean, sometimes, yeah, there are practical considerations. But I will say that you can put your baby to sleep and have a date night in your living room
That's a good
and
idea.
try to connect that way, play like a fun game for couples or, just have some dinner and connect and try not to talk about the baby, but really to focus on each other during that time. So if you do have those practical constraints, there's still ways to do that. Yeah.
I mean, I would say what I see for women doing around here that don't have local family, they just ask their friends for recommendations if they have trusted sitters, for example, that they can, lend out on a Friday or Saturday night, for example. Sometimes these full-time nannies are looking to pick up some extra work on the weekend, and the family has already vetted them, right?
Yes,
So
that's
that's
great
important.
suggestion. Also, there's I know we have a ton of mom groups
Yes.
on social media that, can we have one specifically dedicated to finding babysitters.
Yes.
So that's another way to try to find
I
them.
think social media can be a great way because you don't necessarily even know these moms, but they all live locally. And there's already kind of an inherent trust that comes because this is another mom living in your town, similar age child or children. And when they make a recommendation, I feel like it speaks pretty strongly, right? And then, especially when you see on the thread two, three, four other moms also agreeing, that's great. The same thing can go for when you're building your birth team. And I know that are talking about the mental health team, which it can be part of your birth team and your strategy. But like, there's all these other providers that could be part of that. And if you don't know who all these people are, then also these moms groups can be, I think, a great resource. Like they've personally worked with these other type of practitioners and know that that it's been beneficial for them and their family.
Yeah. No, it's great. Yeah.
Yeah. So if a new mom is feeling, and I've done a few other episodes that have been around like postpartum depression and mood disorders. And what has come up is there can be a lot of shame if a new mom is feeling these feelings and sometimes doesn't want to tell anyone, right? She's like, oh, they're gonna take my baby away, they're gonna think I'm at risk or here. And so sometimes they might stay quiet about that. And I know that, in the book you talk about how it's so important not to stay quiet, how to get help from professionals. So if a woman's feeling that, does she go to her partner first? I mean, like, what do you recommend for something like that?
I mean, anyone really, talk to your partner, talk to your primary care, talk to your OB, talk to
The pediatrician?
pediatrician, absolutely. And I will say that this is why it's also important to speak to someone with perinatal expertise because even the well intentioned providers may not know exactly what they're looking at. They're not going to take your baby away, but they may dismiss it, not intentionally. But I see that happen all the time where women will come to me and it what looks like normal new mom worries and checking and protecting the baby is really, perinatal OCD. You stop
Mhm.
first, you do a more thorough assessment, and that's what can come out. Um, and so it's good to have a provider that knows what they're looking at.
Yeah, that makes sense. Somebody who specializes. I can see, like a pediatrician and OBGYN, that's not going to be their specialty of doing mental health in general. And sometimes it can be easier unless it's like raging that to dismiss that mom, right? But she could benefit from some therapy, right? And learning some strategies, and it's going to make her feel more empowered as a new mom, that she can figure this out. She can get the support she needs. She can get to the other side. I think sometimes when we're in a dark place, we feel like we're going to be there forever, right? It's like, oh my God, this is like never going to end. And, we want that light at the end of the tunnel to know that we're moving towards this resilience and towards this, vibrant health, and why that's not only so important, number one, for us as women, but also, of course, our whole family benefits.
Oh, exactly. I mean, postpartum affects the whole family.
Yeah,
Yeah.
it really does. But we always want to, the self-care comes for us first, right? We're putting ourselves first, because we're worth it, right? We deserve it. We deserve to be happy and healthy, and to have that, to really cherish those first few months, first year of that baby's life is so precious and so finite, and it goes really quick. And we want to really kind of soak it all in, right?
Yeah, I mean, I say, what good is a bundle of joy if you can't experience the joy? And I think postpartum can rob us of those moments and we can't get that time back. And
Yeah.
so I just want to empower mothers and help them feel better than ever, as soon as possible because I understand that's such a special time period, and it goes so fast and mothers deserve that.
They 100% do. And so I guess the question is if a woman is like feeling like the baby blues, which I would say is common, right? And it's kind of like, how do you differentiate when it's crossed over to a postpartum mood disorder? That's where a consultation with a specialist can help you clarify. Do you have women in your practice that you're like, oh, these are baby blues versus an actual diagnosis, and they're still learning coping strategies to help them feel better?
Yeah, I mean, I get this question all the time because I take it for granted. I think that everyone understands baby blues versus postpartum, but really that's not the case. And we have to do a much better job at educating women and society and partners and families. And so baby blues is only going to happen in the first 2 weeks after giving birth. If it's beyond that, you're entering into postpartum territory. Baby blues lasts maybe 3 to 4 days at most. It's gonna feel bad, you're gonna be weepy, you could be really anxious, you could be crying and, really feeling down and hopeless, but that will pass. If it sticks around for after that 2-week cutoff, then you're entering into postpartum territory.
Right, postpartum mood disorder, and then that's where a consultation with a specialist is valuable
Mhm.
to kinda get clarity around what's happening, and then the support, right? And would you say with the women that you're working with, how many of them, is there a percentage about women that are doing holistic therapies versus needing prescription medication for postpartum mood disorders?
Yeah, I have a mixed practice. So some patients will do just therapy and that works well for them. And some others will also go on medication and do the therapy at the same time, which we know has a synergistic effect. But the point of the medication is that if you are not feeling well enough to do the strategies, then therapy is not going to help you. And so we want to help you make use of the therapy. And so even if you're not on medication forever, it gives you a nice boost so that you're able to do the things that are going to keep you well, get you well longer.
Right. Yeah, if you can't do the coping strategies, then like what is the you're not getting the value out of the therapy. And then what I find too is these women would benefit from body work like chiropractic, acupuncture, massage, certainly nutritious eating nutritious foods, sleep, preservation like you had mentioned is so important because anybody sleep deprived is going to have difficulty functioning.
Yeah.
In my practice, we have a brain tap guided meditation, which I love because 20 minutes is equivalent to 4 hours of sleep. And it's a nice biohack for these sleep deprived parents to help them feel more well rested and able to function.
Mhm.
And then, even getting some exercises, whether it's a walk or some time outside in nature. We know all of these things benefit exercise. Exercise is huge. So, right after birth, maybe it's a very short walk, but as you're getting stronger and recovering, we know exercise is so valuable for mental health. Is that
Yeah.
part of your prescription as well?
Absolutely. I mean,
Yeah.
exercise is nature's antidepressant. So I'm heavy on the exercise.
Yes.
Yeah.
As much as possible, especially after getting
Possible
cleared.
that there are real physical limitations, as you mentioned, right after giving birth. So
Yeah.
sometimes, like for me, I know when I went through postpartum, like exercise was a big way that I managed my mood and anxiety throughout my life, maybe not knowingly, but it was just really important and helped me. And then when I wasn't able to do it, I had to find a new way to cope. So, um, I obviously still exercise regularly, but when you have a baby, you have time constraints, you have physical constraints, and so it forces you to sort of change things up and discover what's gonna work for you now that may have not worked that wasn't the way you operated in the past or wasn't the way you exercised in the past.
Yeah. Well, that's the whole thing. Becoming a mother does change everything, right? Like how we do everything is gonna be different, and I think what I find is when people have done the work to be really comfortable with uncertainty and change, and then they're entering motherhood, they're going to be better equipped for all of the uncertainty that comes with motherhood.
Yeah.
When we expect things to stay the same, then we get really stressed about that because it's just not possible.
Yeah. Yeah.
Right. Well, Nikki, any last thoughts you want to share with the audience?
Yes, of course. So, the paperback for Rattle just came out. The hardcover has been out for a while. It's also available on audiobook. So check it out. And if you do read it, please leave a review. You can always reach out to me with questions or discussion. I love hearing feedback from readers. And definitely follow me at Dr. Nikki Pensak on Instagram as well.
Is the book on Amazon and Audible?
It's yes, Amazon and Audible and everywhere books are sold.
I love that. And did you read it yourself for Audible? Because I'm a big Audible fan.
I did not, but it was okay because they let me pick the narrator, and there were a few that I really loved, and so I'm so thrilled about the narrator.
Yeah, awesome.
Yeah.
And I would say for new moms, sometimes an audiobook is so much easier.
It's the only way I can read, honestly, still.
I mean, for me, commuting, I am consuming all of my books right now essentially through
Yeah.
Audible. So I love Audible, but it's great that your book is available because then it just makes it just more accessible, right, for
That was
people.
so important to me, and Audible has been such a great support for Rattled, so I'm so thrilled about that. Yeah.
Awesome. So everyone, check out the book Rattled, and thank you so much for coming on the show today.
Thanks for having me.
Well, I hope you enjoyed today's show. Definitely make sure to check out Dr. Nicole's book, Rattled: How to Calm New Mom Anxiety with the Power of the Postpartum Brain. And additionally, if you feel like you need some extra support, some one on one guidance with your own personal health journey, I am here to help. As an IFM trained functional medicine practitioner with over 20 years of experience, I am now offering virtual functional medicine consultations, specializing in preconception, fertility, and women's health. If you want to find out more, check out my website at drlaurabrayton.com. Click Become a Patient to schedule a complimentary 15-minute discovery call with me to see if my program is the right fit for you. And also, if you love this show and you want to spread the word and let more people know about Well Adjusted Mama, please leave us a review. Go to ratethispodcast.com/well adjusted mama and follow the simple instructions.